In this morning's Woman's Doctor, you might hear it from a family member or a friend. If you keep on running like that, you're going to wear down your bones. But the question is that really true? Will you get arthritis from all of your daily runs? Dr. Mark Slabaugh from Mercy Medical Center is joining us now with the answers. So, Doc, is it true?
It is not. Yeah, there's some correlation that running can increase your risk of arthritis, but recent evidence shows that that really is not the case. So I think that patients really can run if they would like to without worrying about arthritis in their knees or their hips.
All right, let's just talk about arthritis in general. What are some of the risk factors?
Some of the risk factors are the biggest one is family history. If you've got a father or mother that have had arthritis in their knee or their hip, then the likelihood of you having arthritis is very significant as well. BMI or your weight, and then also any previous knee or hip injuries, those are the biggest risk factors for developing arthritis.
All right, so we talked about managing your weight. What are some of the other ways that you could sort of manage your risk of getting it?
So really what you want to do is if you're looking at starting a running program, you want to start out with lower impact exercises first and then really gradually work your way up to it. So typically what I recommend for my patients is they start out with either swimming or biking, then they progress to the elliptical, and then they can start doing some running gently, and they start at a very low speed, and then gradually as their symptoms go away and their strength improves, then they can start to do more and more running and do further and further distances.
Yeah, so for someone who maybe is just starting out, one of the risk factors, I know that you're worried about your knees, right? And some of the cartilage. So is walking better? Should you choose one or the other?
Really, there's no difference between walking and running. It's something that you should consult your doctor and talk to them. It's very patient specific. You have to get some x-rays, you have to look at the knee, you have to examine the knee, and then you and your doctor can make a very good decision together about whether you should start either running or walking. But walking is always the best option for individuals that are starting out to help get their knees stronger and stronger so that they can develop that strength to one day hopefully start to run again.
And once you get arthritis, there's really no walking that back, is there? Is it just more of like how you're going to manage it and keep it from getting worse?
Yes, yeah. Really the goal when patients see me, if they already have arthritis, is to prevent further deterioration of their joints. And that is something, like we mentioned before, that you really have to consult your doctor to make sure that you're not doing any further damage by the exercises or the activities that you're doing.
All right, Dr. Slabaugh, thanks so much for joining us this morning. Really appreciate it.
You're very welcome. Have a great day.
You too. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY. Stay with us.